Hello, my name's Josh Hardman, and I'm here to provide a brief update on an executive order that President Trump signed this morning that broadly aims to accelerate psychedelic research and access. So it has three sort of primary objectives: to accelerate access, as I suggested, to fund research that's being undertaken by states or that's being funded by states, to increase collaboration between Department of Health and Human Services, the VA, and industry, and then I'll share some very brief closing thoughts. So that first one, really looking at Section 2 and Section 5 of the executive order. So the first sort of batch of policies are to give commissioners national priority vouchers to psychedelics. So these are vouchers that the FDA can hand out that aim to reduce the review timeline once a new drug application is submitted from around 10 to 12 months down to a matter of weeks. So we saw last October, FDA had hoped to give one of these to Compass Pathways for its psilocybin for treatment-resistant depression program, but it seems that the White House actually got in the way and decided to veto that voucher. So now, almost a 180, with Trump announcing or signing an executive order that says that these vouchers should be given to psychedelics. And we also heard at the signing ceremony that there are 3 psychedelic programs that will receive these vouchers in the coming weeks or potentially this coming week. We also saw that the executive order directs the Attorney General, in consultation with the Department of Health and Human Services, to begin the rescheduling review process, not when the FDA decides to approve a drug, but instead doing that as soon as the phase 3 is successfully completed, the language says. So that could potentially save, up to 90 days generally is what, the upper limit on a rescheduling decision from DEA. So, that could potentially shave some weeks or months off the timeline as well. So both of these actions potentially meaning that once a drug development company does have their new drug application package ready to submit and submitted to the FDA, the timeline for both approval and federal rescheduling at least may be substantially quicker. The second of these accelerated access developments is clarifying that psychedelics, Schedule 1 drugs, can be accessed through the Right to Try Act, which was signed into law by Trump in his first administration. It essentially provides a pathway for people who have life-threatening diseases who have tried or exhausted all other options. So that means drugs that are currently on the market, as well as clinical trials. And it allows them to access investigational drugs like psychedelics. There had been difficulties getting people access to Schedule 1s through that pathway, and there have been some legislative efforts to try and clarify that. But now that appears to have been done via this executive order today. The second area is funding for state-funded research. So at the moment, some states like Texas in particular has appropriated $50 million in funding for ibogaine research, and it had hoped to have private drug developers match the other half of that 50 million, or sorry, an additional 50 million. So 100 million in total, but that fell through as it was announced late last month. So now it appears that the federal government via ARPA-H is stepping in to kind of backstop that funding and potentially to work with more states with this match funding for psychedelic research. So this is quite an interesting develop, a relatively modest amount of money, but it does say at least $50 million. So there could potentially be more. But for now, that's drawing down on existing funds. ARPA-H allocated $100 million to research broadly in psychedelics, but also in interventional psychiatry last year through its Evident program. And it seems that this is going to be drawn down from that funding as opposed to being new funds for now. And then lastly, this sort of more nebulous section, Section 4, states that the Department of Health and Human Services and FDA, which obviously sits within HHS, will collaborate with the Department of Veterans Affairs and the private sector. It seems like some sort of data sharing agreement. It says that the goal is to increase clinical trial participation, increase the sharing of that data, and the generation of real-world evidence regarding psychedelic drugs. So interested to see, how this fleshes out here. So in terms of closing thoughts, this is obviously a very remarkable moment. The signing ceremony is worth a watch if you haven't seen it. It's very interesting. Joe Rogan prominently standing behind President Trump, but also representatives from NIDA director Nora Volkov was there, representatives from other areas of the research world, as well as veteran advocates and Americans for Ibogaine CEO Brian Hubbard. Fascinating on many levels, the ceremony. And now we have to wait and see how this executive order translates into action and what this means for the researchers, companies, and obviously for patients. So a fascinating development, and just wanted to bring you this very brief update.